Hello, this is Dr. Gay from First Lake MRI, and this is a 20-year-old male with complaints of ankle pain for about 2 years, and the doctor thought they may have an osteochondral defect or their talar dome, and sure enough they do. So this is a sagittal T1 weighted image. To get oriented, we see the tibia coming down here. Here's the bottom of the tibia, tibial plafond. Here's the talar dome. This is the Achilles tendon in the back looking totally normal. This is the calcaneus, the heel bone back here. Along the bottom of the plantar fascia, and this gray stuff is muscles. So now we're oriented, looking at the ankle from the side, and to look for the talar dome osteochondral defect, we see the talar dome here. We roll medially, looks very good. We roll laterally, and right here in the lateral talar dome, there's a dark area. Now we're going to put up a coronal view to look at that a little bit better. This is a coronal view. We're looking straight at the ankle now. We can see the tibia coming down. We see the medial side. Medial malleolus here. This is the fibula. We call this the lateral malleolus. And this is the talus. This is the talar dome. It looks pretty square on the view where you're looking straight at it, and it looks like a dome, rounded dome on the side view. But now we're going to look for that osteochondral defect. And there it is, right over there. We see this area that's dark, and that's the OCD. And these can sometimes become loose, and the bone fragment can be displaced. So that's an important thing we have to mention. Is there loosening or displacement? And there is not. So it's a small osteochondral defect that can cause pain and joint effusion. They have a little bit of fluid over here in the joint. But there's something else going on here. There's lots of marrow edema, way more than you'd expect in these other bones. So this is a view where marrow edema shows up. We see this unusual bright pattern of marrow edema, the calcaneus, the heel bone. We see the marrow edema in the bottom of the talus here. And again, this is the side view. Marrow should look really dark in this view, but instead we see it bright here. This is the cuboid bone. It's really bright, so very unusual pattern of marrow edema. They also have a little bit of beaking in the front of the talus here. It pokes up just a little bit. And this may be related to an abnormal fusion or abnormal articulation here between this calcaneus and this bone is called the navicular bone. And this is another view of that. So here's the anterior calcaneal process here. It ends, and there's an anomalous articulation with this bone. This is the navicular bone, and right here where they come together, they should not have a broad articulation like this. They can come together and touch or be really close, but to have this broad area with a little bit of spurring and a little irregularity is called a coalition. This is a cartilaginous coalition. Sometimes the bone will go right across and be fused, and we call it an osseous coalition. Sometimes you have a little sharp band of darkness. We call that a fibrous coalition, just fibrous tissue. And this one is, again, a cartilaginous coalition because there's gray tissue there. And sometimes people have marrow edema with these, but this patient doesn't have marrow edema here, just elsewhere. And again, I assume this is related to the coalition causing abnormal mechanics of stress. So 2 findings: an unusual pattern of marrow edema related to a calcaneonavicular coalition, this anomalous articulation, developmental finding here. All this marrow edema related to that. Here's fluid back here. And also we have this osteochondral defect, which is not helping anything, but sometimes they're probably more related to this other process. And that's it. Thank you very much.